Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. When you are called upon, we will unmute your microphone, and then you also will have to unmute your microphone.
Good afternoon. Thank you for joining us once again. Today we'll have reports from the Commissioner of Indiana's Department of Transportation, Joe McGinnis, which you'll be able to share some more details about our community crossings program and some workplace safety zone progress and measures that are put into place, specifically about the community crossings program, something that we started back in 2016, and now it's well over $700 million of local and state dollars that have been partnered together in our bigger cities and in our smallest towns. Earlier this year, we had to push pause on this latest round. Wanted to be prudent, wanted to make sure that we had the funding from a state perspective to go out to locals to get these projects, many of which would just kind of sit on the shelf. I mean, we've got our local and our state projects that are ongoing and have been ongoing, but this is on top of all of that. And I'm just thrilled and pleased that we're able to get that back on track, that program back on track. And so you might go into detail about community crossings and what that means for the fourth quarter, and you can give a more exact time frame in November, I guess, the award. But folks will start applying here soon. And then, Dr. Box, you've got a number of updates to make, thankfully, one of which is a lot of our most, quite frankly, of our new cases in a specific age group. We're not surprised by that. You've touched on this more than you've elaborated on it, not just alluded to it, but just the congregate living that's occurring on our college campuses and kind of the impact that has had on our overall outlook. And then some progress made on our dashboard with all of our schools participating and all the cases that are within those individual schools. And then also, if you would, I think this is on your to-do list, give us an update on all those, the progress that we're making locally with all those additional testing sites. We infused local county by county with dollars so that they had the ability to make investments in terms of testing for over the next 2 years, which can give a lot of confidence and comfort to folks to know that it's close at home. Also, we're approaching, and I hope you go into this is something I myself like to learn about, we're approaching this third round of the Fairbanks scientific study. And so you'll go into detail about that, I'm sure, but I would just say personally, if you are contacted, please, please, please participate. This is, like we've said before, this is our radar. This allows us to kind of project or see in terms of, is as close to a crystal ball as we'll ever get in terms of having a radar for us to see what kind of spreads truly occurring or projected to be occurring. And so please participate if you get that call. And while I'm at it, pleading for participation and for help, we've also been contacted by the American Red Cross, and hopefully that's on your screen right now. They need our help, and not just here in the state of Indiana, but across the country. Obviously, if you turn on the national news, all over the country there is need. Specifically in 10 states are in need, some of which is for food, some of which for shelter, and just the horrific impact that some of these natural disasters have brought with them. We're talking about the windstorms in Iowa and Illinois. We're talking about the relentless wildfires in California and Oregon and Washington. We're talking about Hurricane Laura in Louisiana and in Texas. And so obviously with the rainfall and the flooding down in Alabama, the list just seems to go on and on and on. So there is need associated with that. And I would just say, if you're able, first and foremost, we're under a lot of stress and strain here as well, and we are profusely thankful for everything folks are doing to help their immediate neighbors in your community. But if you're blessed and able and can help, there's ways to do that, specifically healthcare, kind of our frontline workers. There are ways to pitch in these other states, on the ground in other states. And then you can also volunteer by calling that number 1-888-684-1441, or just go online to redcross.org/volunteer. And they will follow up with you. They are in that much need. Also, just want to make a note for volunteers, speaking of them, here at our local food banks. We're in the process of all of our food banks are calling back their volunteers. They are appropriately equipped with PPE to keep volunteers safe. So we would ask that if you were giving of your time and talent and treasure in the past to food banks, we would ask that you make contact and look to return there as well. And then also just kind of a regular reminder, and this is getting closer and closer to the deadline, the due date, and that is to make sure that every Hoosier is taken into account in terms of the census. That September 30th is the last day. So please, 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 there as well, participate. And, I looked back at the records 10 years ago when we did this. Indiana ranked 7th. And in the good doctor's jargon, that would put you in the 3rd row. And we'd like to be in the front row. Actually, we ranked 3rd 10 years ago, so we were in the front row, but now we're ranked 7th. So now we're in the 3rd row, and we're trying to get back to pole position. And so with your help down the stretch in these final laps, so to speak, let's shoot for number 1, go from 7 to 1. And that just reminds me of another event coming up, and that is the election. And if you feel so inclined and have the time to volunteer with your county clerk to work on the elections coming up in November. This is a great nonpartisan way. Again, Indiana, very fortunate to have so many civic organizations, Kiwanis and Rotarians and associations that do so much for their community. And we know that there's going to be a excited electorate out there to express their voice. And if you would be willing to participate, I'm sure 92 county clerks would appreciate your hand. So with that, I'll kick it over to Dr. Box, and you can give us some updates, and then Joe will go to you.
Thank you, Governor. Good afternoon, Hoosiers. Today, we reported 624 additional cases of COVID-19 in Indiana, which brings us to 107,809 total, the number of Hoosiers known to have COVID. We also saw 12 additional confirmed deaths. To date, 3,247 Hoosiers have died of COVID-19, and another 225 are believed to have died from this disease based on their clinical diagnosis. As of September 14th, 809 Hoosiers were hospitalized with COVID or COVID-related symptoms. While that's higher than our low point in late June, it's encouraging to see that number of patients admitted each day has fallen from 87 in late July to 62 as of September the 10th. Our 7-day positivity rate for total individuals tested was 4.7% as of September the 9th, while cumulative rate for all tests is 6.2%. A few weeks ago, we unveiled our color-coded county map that uses 2 metrics to evaluate how we're doing. Those are the number of new cases per 100,000 residents in the past week, the percent positivity as determined by the number of positive tests divided by the number of administered tests. Today's map shows 2 counties in orange, Delaware and Monroe, and both are due to congregate living settings and large-scale testing tied to university settings. This is a big improvement over where we started, which means Hoosiers are doing a lot of the right things. This is proof that wearing a mask and practicing social distancing does make a difference, so keep up the good work. These improvements come as schools have opened, but we are still watching to see what increased spread we might see from the Labor Day weekend. I also want to share our latest data on hospitalizations and recovery from our partners at Regenstrief. To date, we have looked at 101,226 cases. Of those, about 21% visited the emergency department, which is consistent with last week. A total of 11,858 were hospitalized, which represents 12% of all positive cases and is also holding steady. Of those who were hospitalized, 20% were admitted to the ICU. That represents 2% of all positive patients. Those numbers are consistent with what we saw last week. 76% of hospitalized patients have been discharged. Of the remaining 24%, 6% are believed to still be hospitalized. 18% are known to have died while hospitalized. Regenstrief also estimates that we're especially concerned about our 18 to 22-year-old age group. Our case counts since early August have trended down for all ages except this one. We have seen sharp increases in this age group as universities have required testing and students have returned to campus. We're also seeing a steady increase in the percentage of total cases among children throughout this pandemic. So far this month, the 0 to 19 and 20 to 29 age groups represent nearly half of all new COVID-19 cases. Much of this is due to increased testing in these age groups, especially in the university setting. But we also continue to see cases tied to gatherings of young people, such as sleepovers, parties, and other gatherings. Fortunately, we don't see a lot of COVID hospitalizations in children and young adults. We have had 16 confirmed, actually it was just this morning confirmed 17 MIS-C cases in the state among children under the age of 18. But thankfully, all of those patients have been discharged. But the CDC has found that half of the deaths in individuals under the age of 21 occurred in the 18 to 20-year-old age group. So we need our younger Hoosiers to understand that they are not without risk. We've done some early analysis of cases by grade level, and as you can see, the vast majority are occurring at the college and university level. We saw those sharp increases begin around August 20th. Our kindergarten through grade 12 levels have remained relatively stable since late July. But we do also see almost 19% of our cases among high school students. As more schools return in person, we need to pay attention to these data and recognize that peer-to-peer transmission is occurring more frequently in teenagers and young adults. This is likely because these age groups are less likely to observe social distancing, don't wear their masks regularly, and have larger social bubbles. We hope to gain a better understanding of where these cases are occurring with the new school dashboard and reporting system that we're preparing to launch. We have sent a survey to all schools of the Indiana Department of Education's contact list, asking them to designate 2 representatives who will access the new portal and enter these cases. We've heard back from about 60% of the schools so far and have had some emails bounce back. We're asking schools to report their historical data from when school began through today by close of business on Sunday. Schools that don't submit data will be listed as not reporting. So please check your spam filters, and if you haven't received an email from us asking about these contacts, reach out to us. We want to make sure that we capture the most complete data possible. We're doing some pilot testing of our portal this week so that we can make that live for our schools on Friday. Our goal is to have a snapshot of historical data to show you next week and then present preliminary data by September 30th. We know this is a fluid process and expect to continue to add schools over the next few weeks, just as we did with our long-term care facilities. I also want to provide a brief update on testing availability. As of today, we're showing 253 testing sites across the state. Testing is accessible to Hoosiers now more than any other time during this pandemic, and the number of sites is going to continue to increase. That number includes 40 of the 95 planned local health department sites that I talked about last week. Some of the local health departments are using their own reporting systems, so we don't have data on how many they've tested as of this time. But those that are using the Zotac platform have already tested more than 4,600 Hoosiers. We're excited to see these numbers grow as the remaining counties come online because these local clinics represent sustainable community-level testing. On another testing note, I want to share some updates about labs that we have onboarded in the last couple of weeks. Last week, I mentioned about 50,000 results coming from the vault labs that would impact Monroe and Tippecanoe counties. Those results are all now included in our dashboard. They include more than 270 positive results that hadn't previously been reported to us. The majority of those occurred in Monroe County. We have been working closely with IU Bloomington to ensure that we are getting an accurate count of students who have been tested. And we want to encourage any student who lives on campus or even in an off-campus apartment to use their university address when getting tested. This will help to ensure that we know which cases are associated with the university and distinguish those between the broader community. I also want to make you aware of a situation involving another out-of-state lab that recently submitted results to us. We received results from a newly onboarded lab that contained a file that included incorrect information due to a technical issue on the lab's part. As a result of that, we are removing 469 positive results that had been added to our dashboard this week, and we are expecting a corrected file from that same lab today, which will soon hit our dashboard. I said before that we're adding data as quickly as we get it, and our dashboard has grown significantly since we first launched it in this early part of the pandemic. We recognize that we will continue to encounter situations that require us to correct the data and will continue to provide these explanations so Hoosiers can understand what changed and why. Finally, I want to remind Hoosiers that we're preparing for the third round of testing as part of the IU Fairbanks School of Public Health prevalence study. About 30,000 Hoosiers across the state should have received postcards saying they were randomly selected to participate in the study. This includes children ages 5 to 12. Please participate if you can help us to better understand the prevalence of COVID-19 in our state. The prevalence study begins September 29th and runs through October 3rd, and we will have some supplemental sites on October 4th and 5th to ensure we're including Hoosiers from all corners of the state who represent our most diverse populations. Thank you.
Pardon me, Doc, but did I hear you say, or would you repeat it, that masks are working?
They are working.
That physical distancing
They are
is
working.
working, and the numbers don't lie.
The numbers don't lie. The data shows it clearly. In fact, like Dr. Sullivan shared with us over the last couple of days, Indiana has one of the lowest spread rates in the nation
That
right
RNet
now.
number. So
Mhm,
less
the R-
than 1.
Yeah, less
correct?
than 1, which I was very proud of.
0.94 to be exact.
And we're going for 0.3, right, Dr. Sullivan?
More to come. Good. Well, I mean, I don't want that lost on anyone, that what we're doing is working, and it's allowing us to not just stay open and continue to reopen, but to continue to do it in a safe way. And so when you're talking about, first and foremost, safety and doing it safely, our lives, but also the equal impact that it has on our livelihoods and our economy and everything that's tethered to that, including our well-being.
As you've
mental
always
and
said, that
physical.
delicate balance.
Yeah, and so I just want, it's not what we're doing, it's what we all are doing,
Right.
and it's what you are doing to make sure that Indiana's, quite frankly, one of the most open states in the country right now. And when you look at our unemployment rate, Fred Payne is here, and Friday, I guess Fred will get the latest updates, but you know, our unemployment rate had been at 17.5. It was adjusted up at 17.55%, up from 3.2. And the last figure that we had, we were at 7.8, and we project that it will continue to tick down. So we want to continue this momentum and make sure folks who have been crushed by this in terms of their savings, their job, their business, that we continue to feel the pressure to keep crushing it on our end, meaning attracting more opportunities and making sure the resources are here so people can reskill or skill up to pursue these opportunities. So thank you. I just didn't want that. I wanted to underscore that because that's the proof that we're on the right track, and we need to continue to be vigilant and not just celebrate that we're at a 7-day 4.7 positivity rate, but it's got to do with what's coming as well, including getting colder outside, more people going inside, the flu plus COVID, making sure that we don't overwhelm our hospital network. So just critically important, but kudos to Hoosiers who have been masking up, who have been physically distancing themselves, so it's not like we're all moths to a flame. And then unknowingly, and we just know, you talked about the students and where that uptick is occurring. Well, you're right, you said, it's not probably going to hospitalize that individual, but what happens when it's passed on? The next person that they see, just like they contracted it from someone that they just saw. So thank you for that report. It truly does give us the pathway forward, and we'll continue to, as you said, and continue to open up the state and get everyone back on track so that we can address those evictions and the homelessness and the hunger and all those other equally important issues. With that, let's talk about building roads, Joe, and who's traveling on them and your calendar.
You didn't even see my notes before this, but you teed it up pretty well for me there. Based off of the information that Dr. Box gave us, I don't think it's any coincidence because Hoosiers are getting out and about again. And our traffic volumes around the state are rebounding to near pre-pandemic levels. I haven't been on a while, but I think the charts that I was showing before, we were in the neighborhood of 45% vehicular traffic, particularly passenger vehicle traffic, down. Now, the 2-week period from August 23rd through September 6th, the overall traffic compared to the 2 weeks prior to March 24th, the pre-pandemic where we really got hit, is only down 13% compared to that period of time. So we're starting to get back. People are starting to get back to work, starting to get back more involved in schools and extracurricular activities. Back to shopping and spending money here in the state of Indiana. The even better news is for the freight traffic in the state. And we are actually at or slightly above freight traffic pre-COVID levels, which is a very strong indicator based off of the numbers you gave. And hopefully we'll have some even better numbers on Friday from DWD on our continued economic recovery. And so those freight numbers, I think, are very critical as we're looking out into the very near future and the long distance future, that we're slightly higher actually than where we were at pre-COVID levels. I think that's a great indication. And you all are doing it with a bunch of orange barrels and barrier walls scattered around 92 counties around the state of Indiana. And as you mentioned, weather's going to be turning cooler. Construction season is still in full swing, and we will continue to manage and to facilitate hundreds of projects around the state. Typically, road construction oftentimes will conclude sometime in mid to late November. As long as the weather cooperates, we're at over 1,100 projects this year. We need some cooperation from Mother Nature. So as long as the weather cooperates, we will continue to push these construction projects even into December. Some of you may not appreciate that, but we were making sure that we're using the dollars that are provided to us efficiently, and we want to get these projects done for all of you. I can't say this enough. I say this every time I speak. Please continue to watch the work zones slow down. Speeds are up. I see it every day, particularly on the interstate, so speeds are up, but especially in those work zones, put the phones down and watch our speeds. Speaking of hands-free, we are now 3 months into the state's hands-free while driving law. And we continue to work with law enforcement, state police, and our local law enforcement partners and our industry partners as we continue to spread the word and educate Hoosiers on embracing hands-free ways to use their mobile devices safely while we are driving on Indiana roads. Total work zone crashes and fatal crashes are both down more than 50% this year, and that speaks to the commitment from law enforcement and to our contractors and to you Hoosiers to making sure that our employees, our contractors, and you get home safely at the end of the day, because that's the most critical piece of all of this that we do. Now on to what you mentioned and what's on the screen. Some even more exciting news here in Indiana as we are executing our Back on Track plan. It's in full swing. We are happy to announce today that the program that so many in local government covet, our Community Crossings Matching Grant Program, is back. And Community Crossings, the Matching Grant Program, as the governor mentioned, began in 2016 as a partnership between the state, cities, towns, and counties to invest in local road and bridge projects. These are not state highways, these are not U.S. highways, these are not interstates. These are strictly, I call it our Main Street Indiana program, and that's strictly what these dollars are for. And it is geared towards leveraging our state matching dollars with those locals for existing roads and bridges. This isn't a new capital program, this is to take care of what we have. These projects encourage economic development by ensuring that the first and last mile of our transportation network, which we all know from many businesses and healthcare and education, is a local road. And we want to make sure that we are able to support it through freight and with the freight and logistics, and allowing those companies to grow and to create jobs here in Indiana. This program has been, as I mentioned, has been incredibly popular. To date, the state has invested more than $730 million in local projects just in this program alone. And I'm also proud to say, and Governor, you've been along for many of these road trips, there have been projects funded in all 92 counties. So that's a great accomplishment to the locals for getting engaged and partnering with the state and NDOT for these dollars. In January this year, we awarded more than $120 million for these local projects, many of which are probably underway. You're seeing them in your own communities now, or they've recently been finished. And we planned on doing a summer call that first Monday in July, but as many of us found out, the COVID-19 pandemic had other plans for us. So we had to put it on halt because of decreased traffic volume due to the pandemic. It created revenue uncertainty for us and for the locals and for this matching grant program, which is the budgeting source for community crossings. As traffic rebounded, as I mentioned, over the summer months, we've analyzed the existing funding available as well as what we anticipate to come over the next few months of this fiscal year. And I'm excited to share today that we are moving forward with our second community crossings call for projects of 2020 this fall. Obviously been delayed 2 or 3 months, but nevertheless, we're here. And so proud to announce that our application window will open next Friday, September 25th, and we will accept applications through the close of business on Friday, October 23rd. And then those projects will be scored. It is typically, we do get requests for more dollars than we have, and so it is a competitive, very competitive program, and so we will score those projects and make those funding award announcements sometime in mid-November. Like I said, back in July, we didn't know whether we would be delaying or canceling community crossings call for this part of 2020, but we know how much of an impact that was to the program for many locals and the job creators in our state. Couldn't be happier that this project or this program is alive and well as we enter the fall of 2020. We are proud of the continued partnership with the local government to deliver on our commitment to take care of our roads from interstates to main streets. And Governor, I hope that sometime later this fall,
But wait, there's more?
we get to go back out and present the big checks that you've seen on the screen and mingle with some of our local partners and provide them with some of those matching grant dollars. We'll do it safely, Dr. Box, but I want to, looking forward to hopefully being able to get out there this fall and award some of those big foam checks. Thank you.
Let me put you on the spot. Give me, you've got multiple examples, because I think I got a few rattling around up here too, but give them an example of the smallest project that wouldn't have gotten done without this program or partnership?
Yeah, I think one of the coolest stories, and I know I've told you, is a community down on the Ohio River called Mockport, Indiana, less than 100 people population. And it's been about 2 years ago now, they applied for some dollars and they received over $100,000 in this matching grant program. They had about 3 miles of roadway in the entire community. And without the injection of this $100,000, I don't know that they would have been able to just continue to put a Band-Aid on this problem. And so they were very grateful. I think it's one of those really cool stories of truly impacting Main Street in Indiana, where you have less than 100 people that live in the community. And that's across the state.
Right.
We have it on the Ohio River, we have it on Lake Michigan,
right,
and everywhere in between. And so, and I've seen some of the economic growth that's come from this. My own community, 2016, when I was mayor of Franklin, I was the beneficiary of one of these $1 million grants the very first year. And if it weren't for that and the project that we did on Wayne Street, Indiana, just south of the courthouse, we had some local investors invest $5 or $6 million into an old building that coincidentally, where they manufactured the uniforms for the movie Hoosiers. It wouldn't have happened.
You had to get that in there, didn't you?
I had to get my basketball
You did.
reference in there, but it wouldn't have happened.
And just real quick, just give the city and town population breakdown, kind of over 50,000, under 50,000 for the city, town, and then the county.
The counties, yeah. So by statute, we separate these dollars out 50%, 50%. So the smaller communities, the smaller counties have just as much ability and competitive edge to get these dollars as Indianapolis or South Bend or Evansville, for that matter. And so those dollars are parceled out, and we make sure that they are split evenly 50-50.
Yep. Counties and cities, different
Same.
applications. Yep. Perfect. Okay. And you did say masks are working. No. Just wanted to get that in there for the third time. We'll go. Rachel? Why don't you go right to Q&A?
Dan Klein, Wish TV.
Dan, good afternoon.
Good afternoon. 2 questions for you. One, do you have any thoughts or preview to an extension of the mask mandate? And then love to hear your thoughts about the Big Ten's big announcement today, restarting football.
No, I don't have any preview for next week. We're dealing with this week. And it honestly, Dan, it just would be irresponsible for us to start to move that far down the road. Obviously, we're looking at a lot of different information, and we'll continue to do that up until next week. As I said, if you're a discerning viewer or listener, I feel good about the direction we're heading. If you rewind the tape and look back 7 days or 14 days or 30 days, we weren't in this position. And, you know, I wear a mask every day, all day. I'm in a lot of different meetings, and I may not like them every second that I'm wearing them, but I know it's working, and I know I'm contributing to staying open and making sure we don't overwhelm our healthcare system. And so if ever, you know, I feel good for that reason, quite frankly, that if our numbers were going down like they are in some other areas, I'd be scratching my head and looking for a different reason. But the virus, here's the deal. The virus hasn't changed. It is still uber infectious. It is still ravaging different parts of the country. The virus has not changed. It's we have. And the more that we do, and the more that we do the things that work, the better off we'll be. And we'll continue to see folks go back to work. And so that's kind of looking back, Dan. I'm taking an opposite approach to answering your question, but not forward. But again, if you read between the lines, I feel good about the direction that we're going. And we can continue to make improvements on that front. Your second question, Big Ten football. I said no one was more excited to watch football, especially my home state play. A few weeks back, if we got to the point to where we could do it safely, looks like they've figured out the way to do it. And so I'm looking forward to a good bucket game.
Kathy from the Ferdinand News.
Good afternoon, Kathy.
Good afternoon. Hope you're all doing great today. I have 2 questions that I'd kind of like to ask separately, and I'm sorry, neither are for you, Governor. The first one would be for Dr. Box. And and I'm looking to the future, but not exactly. Halloween. I'm in a rural area. We have small towns. All the towns are trying to figure out. I thought it's kind of been projected that picking something up is, you're probably not going to get it off a book from the library or picking up candy from a bowl, but all the towns are struggling with, should we do Halloween? Should we allow it? What should we do? And that may seem like a trivial question, but it's going to be here before you know it, and they're kind of wondering how to proceed.
It's a great question, one that already many of our local health departments have been working with their local communities on. I think that it's a little bit early to call where we should be on, October, late October at this point in time, but if a county's or a community's numbers are low, I think that Halloween can occur safely. Again, it's about washing your hands carefully, right? It's about not letting your kids dig into that pumpkin in that bucket and eat it as they're walking around unless their hands have been washed. So, it's having a talk with your older kids that are going out, and it's talking to your younger kids and making sure that you've got those wipes for their hands. I think also that you could do something. Rather than have 1,000 kids reach into the bucket, you could probably have the person there at the door that's passing it out who just washed or cleaned their hands and then put it into individuals' buckets. So I think there's a lot of safe ways to do it. Again, I don't think big Halloween parties with lots of kids at one time is a good idea, but we'll try to come out with some more direction or advice prior to that time. And again, it will depend on what each county looks like. Where are their numbers, and what does the local health and public health and elected officials feel comfortable with?
Thank you for that. This one maybe is for you, Governor. When you asked Commissioner McGinnis about like the percentages with the community crossings, will it still be that communities 10,000 and under, 75% from the state, 25% from the communities? Okay, I just want to
Same exact program. We just pushed pause. Would have done it earlier if COVID-19 hadn't washed upon our shores. And now we're to a point where it's responsible to move forward on this front. So nothing's changed with the percentages or the population.
For all these communities that I cover, I'm going to say thank you, because that has been such a boon to all of Indiana, I know. But I know here in Southern Indiana, it's greatly appreciated.
A lot of credit, Joe, you can confirm this, but a lot of credit goes to the folks in the General Assembly and with AIM, the cities and the associations, cities and towns and counties, who all came together back, like you say, back in 2016, but then recommitted to this on an ongoing basis. Huge. And by the way, also you might want to just talk about, that's not directly related to community crossings, but our TRACS program too, that has done a lot of work around the state of Indiana in terms of safety.
Yeah, the local TRACS program, which it was part of the 2017 legislation, and announced those award winners. I believe it was in December of 2018. We were up in Gary, and I think we made that announcement. It was about $125, $150 million worth of investment in communities that are impacted by rail, in the sense where we're trying to create safe passageways for vehicles to navigate over or under, in some situations, rail crossings. And so those dollars have been all appropriated out. And working with those communities, I think there were 10 or 12 projects around the state, primarily northern Indiana, northwest Indiana, due to the fact that some of those communities have 50 or 60 trains rolling through their town on every single day. And those projects some are underway, but most of them are still in the design and the planning process.
Yep.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Good afternoon, Dr. Box. Governor, a couple questions, mostly for you. Number one, obviously we're all concerned about Supreme Court Justice Loretta Rush, and she told us that she was diagnosed, contracted COVID-19. Kind of back timing, she was at a news conference with you folks on the 26th. Have you folks been tested? Any processes taken since getting that knowledge that the Chief Justice of the Supreme Court has been diagnosed for COVID-19? And number two, my second question is, are you worried or concerned that some Hoosiers may be getting sort of pandemicked out? There was in Kosciuszko County, there was a mass burning situation going on up there. So are you worried that even though we're making progress, we're still, just maybe not getting it quite as well as we'd like to?
No, like I said, I completely understand the fatigue to take your second question first. Completely understand this. This is not unique to the state of Indiana or to the United States of America. Folks are, at the very beginning, they thought maybe this too would pass much quicker than it has or will, quite frankly. So I think just to get into the right mental frame of mind to take this long-term view of what needs to be done so that we can remain open. That's the most important thing. And I hope folks see these numbers and they understand that this, you mask up to stay open. If you care about Main Street, if you care about the economy, you only have to look around into some other places that are doing the opposite, closing down. And so I don't like them either, but it's just a fact of life right now. And it is a fact of underscore 3 times life. So, Abdul, that's my appeal is, the more that we do the things to manage our way through this responsibly, the sooner we'll get through this. And a lot less destruction will occur along the way. So I'm just asking everybody to do their part. And the first question you had was, the Chief Justice, Loretta Rush. We did look back, and I went right to you and asked, what should I be doing?
We talked to Chief Justice Rush, and by the way, she's doing well. When I talked to her yesterday, and so she's in all of our prayers. But there was no overlap of time that we were concerned that she would have been contagious.
And you might, for not just Abdul's benefit, but for everyone, just go through if, tracing has occurred and you're contacted, what is the timeline once again? Because I was asked that as soon as this
So we
news
always
hit.
look 48 hours before somebody becomes symptomatic.
Yep.
And look at that point in time on forward. So it would be that close contact, 15 minutes within 6 feet during that time. And she did a great job, worked with our contact tracers and gave a lot of information. And she and the courts have done amazingly well. I don't think they've had another case in the courts. And she, worked her plan. They showed us their plan early on, and they have been very fastidious and followed that plan. And so I think that when you make a plan, the key is you have to follow it.
Execute the plan, yeah. And but we'll keep the Chief Justice in our thoughts, and we're here for her.
Ed with Legislative Insight.
Hello, Ed. Good afternoon.
A pair of questions for Dr. Box, and they're both kind of related. Dr. Box, back in the day when ISDH was preoccupied with hepatitis A, restaurants were required to report their Hep A cases to ISDH. We saw restaurant closures, and we saw additional testing of restaurant employees. There doesn't seem to be any comparable required reporting with COVID-19 and no closure protocol. Could you please explain how the COVID restaurant-related cases are or should be handled? And then along the same vein, casinos don't seem to want to talk about the number of COVID cases among their employees, and they say that they report their cases to the county health department as required, but not to ISDH or to the Indiana Gaming Commission. Do you think ISDH or the Gaming Commission should keep track of and make public the number of COVID cases at the respective casinos, given how many people from transient high-risk populations regularly patronize these closed quarters?
So I'll start with the second question first. If that individual was tested in the state of Indiana and resides here in Indiana, we will have that positive test come through, and it will be contact traced, not just by the local health department, but also by our centralized contact tracing. I have seen several counties, many counties, that have taken action based on repetitive cases in particular settings, whether that's a bar or a restaurant or potentially an entertainment venue such as you're describing. So I feel confident that those individual local public health people are addressing that. Certainly, that those are areas that we are concerned about for people to get infected, and would continue to warn individuals with underlying health conditions that would put them at risk that would probably not be a wise outing. Now, with regards to restaurants, hepatitis A is a little bit different because it's fecally orally transmitted, and so we frequently close those down and look to figure out who in the restaurant, oftentimes it's a restaurant worker, is infected, and then we need to get all of those individuals that are infected out of the restaurant and all the cleaning done, and then can reopen safely.
Max Lewis, WSBT.
Good afternoon, Max.
Good afternoon, Governor Holcomb. How are you?
Fantastic. Yourself?
I'm doing pretty well, thank you. I have a couple of questions. My first one was about particularly concerning the data Dr. Box mentioned about the increase of cases in children. How concerning going forward in the winter is it for you guys that there will be increase of indoor, not just won't be able to have classes outside, but indoor restaurant seating and other things like that? And then I have a second question after that.
So restaurants obviously are always a concern just because you take your masks off, right? And you're sitting hopefully with your social sphere, your family basically at the restaurant, and hopefully still those tables are socially distanced. But that is one time when we take our masks off and would increase our risks. When we look at children, I think that schools that I've talked to have every indication and plan that they're going to be outside as much as they can, whether that's for instruction, whether that's for recess, and continue to use larger areas like gymnasiums and auditoriums so that they can socially distance the kids to the best of their ability. Some of our schools are doing alternative type schedules so that they can socially distance the students. But I do worry about as we move inside, that's certainly an increased risk. We certainly have not seen as many cases or minimal cases from events that are done outside versus inside. So that's something we're going to be watching closely as we go forward.
And Governor, I want to know, you mentioned how well masks have worked, obviously, with our data going on. However, there are some, I think some people are getting some mixed messaging, some things, that come from the White House and other national news or national politicians, sort of sow doubt about how well masks work. And so I guess, how do you combat that? How do you, you obviously are very much about that, and we've shown that that has worked. How do you sort of combat that mixed messaging that people are getting?
I do it daily. And every chance I get, just because, the information that I see, the information that I read, the numbers that I see show that we've made some adjustments in our daily lives, and they include masks, and we saw the numbers. And by the way, we've looked at all these different event-driven dates, whether it was Memorial Day or July 4th or Labor Day, and so we're tracking where we were and where we are. And I just think the proof is in the pudding, and we'll continue to promote good practice. I want nothing more for us to continue with the momentum that we have. They're not just numbers. I'm not just up here proud of all the new job commitments that are coming to the state of Indiana. That, to me, shows that there's a lot more than just hope out there for people's future. I know how much has been lost. It's painful. I don't want to make the same mistakes that have been made in other parts of the world or even here in the state of Indiana, because sometimes it's too late after you make that mistake. So I just try to appeal to people to say it's better safe than sorry. The more of us that do this, the more your local businesses and our state economy will flourish. We're looking at a time in our state history where because of our economic climate, because of all the hard work that's been done in years past leading up to this date, we are a very attractive place to grow. And so when you start to compare the activity that Joe has talked about in terms of freight being moved through Indiana, when you talk about the number of jobs that are being committed and coming to Indiana and growing in Indiana, yes, I'm not losing sight of what we've lost, but we owe it to those folks who have invested a lot into what they've lost, that we're going to do everything we can to remain open. And this is working. This is helping folks stay open and to continue to reopen where we're not. If our kids in school can do this, and we're not seeing that spin out of control because they've put measures in place, if our kids can do it, then I'm pretty sure I can.
Casey Smith, The Associated Press.
Casey, good afternoon.
Good afternoon. I actually have a follow-up question about the Big Ten football announcement.
Sure.
I'm wondering, Governor, if you communicated with President Trump, Vice President Pence, or any other Trump representatives about the president's desire that the Big Ten play football this fall. And I'm also wondering whether you might have additionally communicated at all with President McRobbie or President Daniels or other officials at IU or Purdue regarding the status of the Big Ten football season and what requests you might have made, if so.
Wonder no more. The answer is yes and yes. I did speak with some folks in the administration, and they offered to help us in any way, and I in turn offered both of the presidents any help that we could provide if they needed any. Made sure that I was consistent with what I said here a few weeks ago, that I'm not an athletic director, I'm not a commissioner, but I wanted them to know that we are here and we have a lot of talent and a lot of expertise, and we're here to help should they find the safe protocols that would ensure they get back on the field. Obviously, you saw, Casey, what they put out, and it's quite elaborate. And I hope that October 23rd, I think, is what they put out. I hope that there is a kickoff around that time, and I hope that we get to see where the bucket ends up, whether it's Bloomington or West Lafayette this year.
Brock Turner, WFIU.
Good afternoon, Brock.
Good afternoon, Governor. Good afternoon, Dr. Box. I have two questions here. The first is for Dr. Box. Specifically with the school dashboard, I know that you've mentioned earlier that you were trying to track down 2 reps from each school to sort of input this data on a regular basis with frequency. Could you just shed some light on how many schools have already input that data, and you know, if and just sort of where we're at in terms of getting, you know, a complete picture of what this looks like?
So 60% of our schools have already provided us with the context in the schools that will be using this portal to enter the data. We just opened that portal up basically today. So they'll just now be able to start entering historical data actually starting in the next day. So we want to have that historical data in first, like we did with our long-term care facilities, and then thereafter, starting on Thursday, we hope that once our active portal is up and running on Friday, that they will daily enter the number of students, number of teachers, and number of staff that are positive. And so that will just keep it up, and we'll report that data as of Sunday to Sunday every week. So you'll see it on our Wednesday pressers.
Thanks. And then a quick question for, I'm not sure whether it would be you or Governor Holcomb, but I know Big Ten schools are planning to test athletes daily. From what I've heard with several nursing homes and long-term care facilities, they're worried about hitting the federal guidelines of being able to test their residents with the frequency that the federal government is requiring. Do you think that sends the wrong message when we're able to test athletes daily, but then we can't test our nursing home residents in some cases twice a week or monthly or in some cases weekly?
Well, I believe that we have given our long-term care facilities very good options to be able to get their residents and if the residents need tested, but also their staff screened on a regular basis. So if they are in a county that has a high spread and they need to be testing twice a week, there are several opportunities. The federal government is also providing quick tests like antigen tests and PCR tests that can be used right there on site. So the Indiana State Department of Health is continuing to partner with them to make sure that they have what they need to be able to facilitate and to complete that testing, and that will always be a priority for us.
Sherry with the Star.
Afternoon, Sherry.
Good afternoon. I have 2 questions. One is probably for Dr. Box. The other may be for both of you. The first one is, Dr. Box, if we continue to see such high numbers in certain counties that have large college campuses, would you consider setting up a dashboard for the college numbers to be reported separately? And then the other question, especially vis-a-vis masks, is the CDC last week published a small study looking at the risk of contracting coronavirus for those who eat in restaurants. As we head into the time period where we're going to be indoors more, less opportunity to eat outside when we dine out. Is that for concern? Is that a cause for concern? How does one mitigate risk?
Yeah.
That was in one of their,
Yeah.
sorry, just made my chair go down. It was one of their MMWRs, and in it they said basically that if they looked at individuals that were positive, those that were positive versus negative were 2 times more likely to have eaten out in a restaurant, been in a bar, or in a coffee shop. It is a representation of how much that individual is out socially and active. So it's a little bit hard to sort out, but certainly when we go places where we take our masks off to eat and drink, that is certainly a time when we're at increased risk. When we look at the college numbers, my goal with the college numbers, because it gets really, really confusing. I mean, we just recently looked at, for instance, IU's campus in Monroe County, and in the past month, they'd had 1,500 students go to our Optum site, and of those 1,500 students, about 14% were positive. So that looks like community testing, and those are individuals that are actually IU college students, but they're symptomatic, and appropriately, that testing site is there and available for them, as opposed to the screening tests that the university is doing oftentimes, and then what their clinic may be doing for symptomatic patients. So it's very hard to sort that out. My goal would be that in the near future, as we give updates every Wednesday for data for each of the counties, those counties that have a large university or college that's doing a lot of testing, we would be able to say in this past week, IU reports X number of tests with X number that were positive for a positivity rate of X. So that's something everybody can look at and kind of gauge based on the rest of the county's numbers.
Meredith with WLFI.
Afternoon, Meredith.
Good afternoon, Governor. This question is for Dr. Box. You mentioned earlier in the presser that Indiana has one of the lowest spread rates. Could you kind of elaborate on how you guys figure that out and how you determine that, and how we compare to maybe bordering states?
So that is a mathematically acquired number based on the number of individuals that a single person infects. And that's as far as I can elaborate on the mathematics part of it. What I will say, it's called the RO, basically, the row number, and that number has been published, and I can, if you want, give you that link to that particular report, but I believe Indiana was tied for 6th best in the nation on that. So it was really good to see that we are under 1. We, of course, want to stay there. But unfortunately, I'm not the mathematician or statistician that can explain that.
Just in my terms, layman's terms, I mean, it just means that you're infecting fewer than that 0.94 is, if you're positive, you're infecting fewer than 1 person on average.
Yeah, that's what I would say spread-wise.
Our final question is from Brandon Smith with Indiana Public Broadcasting.
Bring it home, Brandon.
I've got 2 for you, Governor.
Okay.
The first is Senator Mike Braun earlier this week said he doesn't support any help, whether that's in flexibility with current dollars or new support for federal or for state or local governments from any future COVID relief packages. So my first question is, what do you say to a member of your own delegation who's basically saying he doesn't want to give you the help that you've been asking for?
Well, we'll continue to ask for flexibility, and I would, I've spoken with Senator Braun recently, and we'll continue to do that and work with our entire congressional delegation. We've always sought that flexibility, as you mentioned, with the dollars that have been advocated. And oh, by the way, we also have been seeking clarification from various federal agencies before we actually spend some dollars. So I completely understand where Senator Braun is, especially in light of the kind of good news that I've shared about how Indiana continues to endure and rebuild and stay on track to make progress. And I understand his concern that up until all of the dollars are not just allocated but spent, the need to put more dollars there. But I will say this, and the budget director's here if you want, Chris, you can elaborate, but we want to make sure that those dollars are getting to people and the people in need. And I can tell you this, I can tell everyone this, that those dollars that our delegation, that Congress and the administration has got to Indiana, gotten to our hospitals or to our schools or to our state, they will be spent. And they will be spent appropriately to people. And Brandon, before we get to your second question, I'll just, Chris, if you want to elaborate on anything, you look like you do.
Just very quickly, because I know Brandon has a follow-up question. But I think the one thing that has changed over the course of the last 6 months is that when the federal assistance was originally adopted, I think we had a different time horizon as far as what we think the cost would be. And so the legislation is currently drafted to recover or reimburse for costs incurred through December 30th. I believe now that most people in this room think that there's going to be costs incurred beyond December 30th. And so that's just one example of the flexibility that I think would help not only the state of Indiana, but other jurisdictions as well.
Thank you, Chris. Brandon, your follow-up?
Yeah, I know this has been asked of you a lot over the last few weeks and months, but I figured I'd ask just one more time for old time's sake. We are going to have lots of in-person voting opportunities coming up in October, both early voting and obviously on Election Day, with more polling places open in the general election than there were in the primary. But I'm curious why you don't think Hoosiers should have the option to, in addition to in-person voting opportunities, also be able to cast a ballot by mail if they so choose without needing one of those dozen excuses.
To tell you the truth, Brandon, which I always do, to me it comes down to process. We're not hunkered down. We're not in a shelter in place. We're not at stay at home. And so, you know, the Election Commission and the General Assembly have a lot of say if you want to expand the definition of absentee voting. And so I respect that. And now, having said that, there are multiple ways that you can vote for reasons that you can vote absentee. And we'll start voting in the state of Indiana on October 6th, as you rightly point out. So lots of opportunities, and I can tell you as much as voting via mail is becoming popular across the country and in the state of Indiana as well, so will in-person voting. And the bottom line is, it is safe to vote in person for up to 28 days prior to the election. So, you know, when we talk about Election Day, that is your final opportunity to vote. But you have multiple shots on goal leading up to that.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.